myself Rajita, and today I welcome you all to this session. Here we are going to discuss regarding the post-operative care. So already we have studied the first two phase of perioperative care. We have seen about the preoperative and intraoperative phase, right? Today we are going to see the last or the third phase of perioperative care, that is the post-operative care and nurses' responsibility for this stage. So this post-operative care starts immediately the surgery is done or the surgery is finished, and it will be continuing till the time when the person is getting discharged from a medical unit. So you have to understand that post-operative period will be starting as soon as the client is shifted to a intensive care unit or a post anesthesia care unit from the operation theater, and it will be ending once the client is discharged from a medical setup or a medical unit. So this basically includes the care which will be provided into the immediate to the surgery. So once the surgery is done, as I mentioned, as soon as the client is shifted from a operation theater to a post anesthesia care unit or maybe a intensive care unit or surgical intensive care unit, we are going to see the immediate management or immediate care will be provided to the client. So that phase we are considering it as the immediate post operative care. Next, we are going to see long-term post-operative care, which is basically includes the latter phase of the session. So immediately once the client is managed, then we are going to see the care would be given to the client to perform the self-care and to promote their health and healing. So that basically includes the all of the topic related to the post-operative care. So post-operative care basically involves protecting of a client who have high physical risk while undergoing a surgical procedure. It also helps to promote the healing of the surgical incision, as well as it will be preventing complications which may occur due to the surgical incision or due to the surgical procedure. Post-operative care also will be helping the client to gain their self activity, or we can say it also helps the patient to reach to a good state of health after having or after undergoing the surgical procedure. So now we are going to discuss in detail regarding the nurse's role and responsibilities during this post-operative phase. So before going to discuss the nurse's role and responsibility in this phase, we should learn about the common complications or the common symptoms which are generally present in a post-operative client. Symptom and complication may include all of the body systems. It can include the cardiovascular system, respiratory system, genitourinary system, gastrointestinal system, even the neurological system. So, to be very precise, we can say many complications and symptoms may occur over a client in a post-operative phase. So a nurse should be vigilant enough to provide accurate and adequate care to the client so that the patient can maintain their health, as well as that also should include a promotion and betterment of the health, and it should be ensuring that the client is having a great and easy recovery from the surgical procedure. Now, before going to discuss regarding the actual process, we are going to learn regarding the phases of post-operative care. So, phases of post-operative care basically divided into three phases. So, phase one will be dealing with those patients, or it is basically involves the care towards those patients immediately after the surgical procedure. So the major role here is ECG monitoring, vital signs and hemodynamic status monitoring. The goal generally of the medical and nursing care for this particular phase 1 post operative care is to prevent occurrence of any complication or any further complication, as well as the patient should be recovered enough to transfer to the phase 2 post operative care. Now, phase 2 post operative care basically indicating to those patients who are ambulated or who are in a state where ambulation of the patient can be done after the surgery. The goal during the phase 2 post operative care basically involves to prepare the patient for transfer to an extended observation unit or maybe or home and extended care facility. The phase 3 post operative care basically involves a extended observation. The goal here is basically to prepare the client for self-care. So basically in phase 3 we are going to see a extensive education would be given to the client so that they can manage their health on their own and they can promote their healing. So as we have discussed regarding the phases of post-operative care, now we will be focusing on the next phase. So basically here we are going to discuss once the client is done with the surgical procedure, what will be done to that client. So as we have discussed in intraoperative care that once the surgical procedure is done, circulatory nurse will be documenting each and every incident and the general information and health related information. Then the circulatory nurse will be transferring the client to a post anesthesia care unit. Now, here in post anesthesia care unit, the nurses would be taking the handover or hand off from the OT nurse or operation theater nurse, basically from the circulatory nurse. And we are going to see they will be following a post anesthesia care unit admission report. Now, this report would be including the information like general informations, which include first and foremost the client's name, their age, anesthesia care provider and their name, the surgeon or which surgeon has been performed the surgery, the surgical procedure which has been performed for the client that has to be noted, as well as which type of anesthesia the person has administered with that also has to be noted in this report. Next, we will be seeing the nurse in the post anesthesia care unit will be collecting a patient history. Now, patient history includes the present and past medical history, surgical history, basically the present surgical history and the procedure which has been performed, the indications of the surgery, the incidents that has been occurred during the performance of the surgery, as well as we are also going to see the nurses would be documenting the details regarding the usage of medication by the client or the recent medication that has been prescribed in the post-operative phase, any history of allergies. Also, the nurses will be collecting regarding the data related to their lifestyle and personal habits. Physical assessment also would be done. The continuous monitoring should be done for the vital signs, the hemodynamic status, the level of consciousness for the client, as well as their orientation. So this would be basically helping the nurse to identify early if there is any sign related to any complication development is present in our post-operative phase. Also, a detailed history should be collected or should be focused on is related to the intraoperative management. So a nurse in post anesthesia care unit or maybe in a surgical intensive care unit will be focusing on the anesthetic medication which has been used for the client, as well as other medications if it is present or if it is used during the time of surgery, that also has to be noted. Last, dosage of opioid administration should be noted by the nurse here in post operative phase. Fluid replacement and blood transfusion and the amount of it should be noted. Total fluid loss also should be calculated and should be recorded or documented here. Urine output also should be measured for the client. So basically, this would be helping the client or helping the nurse to understand the difference in a pre-operative and in a post-operative phase. Also, we are going to see the nurses would be documenting about the intra-operative course, which basically includes the information like unexpected anesthetic events or unexpected anesthesia events, unexpected surgical events if there is any, most recent vital signs, and the hemodynamic stability which has been monitored after the surgical procedure is over. Also, the results for the intraoperative lab test should be documented by the nurse in post-operative phase. So, as the data collection, history collection, and physical examination is completely done, a continuous monitoring has been initiated for the client in post-operative phase. We are going to see here the assessment of the client would be done in a thorough way. So the assessment would basically includes the assessment of airway for their patency, oral and nasal airway and their patency, the oxygenation or the level of oxygen in the body of the particular client, if there is any presence of endotracheal tube or laryngeal airway mask, the patency of those and the functional ability of those devices has to be assessed in post-operative phase. We're also going to see the client would be assessed for their breathing pattern, their rate and rhythm. Auscultation should be done for their breath sound. Pulse oximetry will be used to understand the saturation level immediate after the surgery. Supplementation oxygen or supplement oxygen if there is any need for the client is also a very important management during the time of post-operative phase. So even if the pulse oximeter is showing there is decreased saturation, oxygen supplementation will be initiated for the client. Next, we are going to do the assessment would be done for the circulatory or cardiovascular system. Now, the assessment basically includes the ECG monitoring. So, a 12-lead continuous ECG monitoring would be generally done for the client who have reached to a post-operative phase. So, also we will be measuring the rate and rhythm of the pulses. We will be checking for their blood pressures, the temperature, capillary refill time, cool or clammy skin if it is present. So basically we will be checking the temperature of the extremities. Even we will be checking for the peripheral pulses. Now this assessment of the cardiovascular system definitely helps to identify any early signs related to the complication development by the nurse for the client who is present in a post-operative phase. Next, we are going to see the assessment would be done for the neurological system. Here, the person's level of consciousness will be monitored. So as we know, immediately after the surgery, the client will be having a altered level of consciousness due to the anesthesia. Now, whether the person is recovering at a particular or at an appropriate time, that has to be monitored by the nurse here in post-operative phase. Also, we will be checking with their orientation if it is normal or abnormal. So basically, this helps a nurse to understand whether the person is recovering from the anesthesia or whether the person is developed with some side effects related to the anesthesia which has been provided during the time of surgery. Nurse also will be checking for their sensory and motor status during this post-operative phase, as well as the pupillary size and their reactivity should be checked by the nurse in order to make sure that the client is not having any neurological deficiency during the post-operative phase. We are also going to see the assessment will be done for the gastrointestinal system. Basically, the client would be asked whether they're having any feeling of nausea, any episodes of vomiting that has to be documented. Their intake output chart has to be maintained in post-operative phase very carefully in order to understand whether their gastrointestinal functional ability is maintained or not in a post-anesthesia period. For genitourinary, we will be definitely checking the urinary output. So this basically helps to identify if the client is having any altered urinary output which is related to the post-surgical phase. Also, the bowel movement should be checked here in order to make sure that client have returned with their peristaltic movement so that the essential nutritional support or nutritional supplementation can be provided to the client in a post-operative phase. Surgical site of the client should be checked at a regular interval. Basically, the goal of checking the surgical site is to identify the early signs of infection if it is present. We will also look for the pattern of healing or the time or the duration of the healing that is occurring for the particular client. We will be also checking the dressing materials and the drainage from the client. So basically, it will be helping to identify if there is any presence of altered drainage or if there is any presence of altered coloration of the discharge from the body fluid. So basically, this will be helping to identify the presence of infection or any altered state. Next, we are going to see the assessment will be done for the pain. So incisional or the area where the surgical incision is made, there the pain would be more. So a person should be asked to rate the visual analog scale for the pain scale rating, as well as the person should be asked or the individual client should be asked for the type and the pattern of pain they're having. Also, we will be going to assess the tolerance of the pain for the client. Depending on that, a nurse or a physician may prescribe certain analgesics to manage the pain for the client in a post-operative phase. Location and type of pain should be definitely noted in detail. So till here we have seen all the assessment of each and every system in details which should be done by a nurse continuously or at a regular interval for a client who is present in a post-operative phase. Now we are going to discuss regarding the potential problems or the problems which are generally found during a post-operative phase for a client. So first we are going to focus on the respiratory problem. So in respiratory problem, we often going to see the presence of airway obstructions, a hypoventilation for the client in post-operative phase. Even there can be presence of complication like atelectasis, aspiration into the respiratory tract, pneumonia or development of pneumonia, pulmonary embolism, and bronchospasm. These are very common complications that can occur for a client in a post-operative phase. Next, we are going to learn about the potential problems which are often found in a post-operative client related to the cardiovascular system. So the major and the most common problem which is found in a post-operative client is dysarrhythmia. So I hope we have learned in details regarding the dysarrhythmia. So it is very important. That is the reason it is very important to monitor the client with a 12 lead ECG and for a continuous interval. So basically it would help the nurse to identify and understand if there is presence of any dysarrhythmias early and proper management can be taken care of. The next common problem which is associated with the cardiovascular system, very commonly seen in the post-operative phase, is hemorrhage. So as we know, the surgical procedure, basically the surgeon would be making some incision here. Basically the instrumentation or the operation would be done for the client. Definitely the chances of the hemorrhage here is very much more. So that is the reason in post-operative phase, a nurse should check the client for presence of any sign and symptoms related to the hemorrhage, which actually helps the medical professional to prevent the development of any complication. Even the client can present with hypotension often in post-operative phase. They can also develop hypertension due to the stress and anxiety and maybe intolerance to the stressor during the time of surgery. Superficial thrombophlebitis can be present or can be developed for the client in a post-operative phase. Venous thromboembolism also is a very common complication during the time of post-operative phase. Now we are going to discuss regarding the potential problems associated with the integumentary system, basically the surgical site. So the common complications which are often seen among the patient is infection. So as we are going to see, the superficial incision will be present, and if So, in case of this, we are going to see if the proper care is not be given to the client, a proper hygiene is not maintained, or maybe the dressing is not changed in a regular interval. We are going to see the person can have an increased risk of the development of infection. For those clients who are immunocompromised, we are going to see the chances of the development of infection is very high. That is the reason our nurse should be vigilant enough to find out the sign and symptoms which may present for our post-operative client very often. Identifying the sign and symptoms of infection at early stage helps to manage the client in a better way. The next complication related to the surgical site in post-operative phase is hematoma. So often we are going to see the client can develop with hematoma. So the necessary interventions should be done to prevent the development of hematoma. Decision also can be taken place in the surgical wound, so that has to be taken care by the nurse. Next, we are going to see the potential problem related to the fluid electrolyte balance. So sometimes, as the client will be receiving continuous fluid transfusion, even they will be receiving blood transfusion in operative or in operation area. Sometimes we will be seeing the person can go for a fluid overload. Even the person sometimes will be having dehydration or fluid deficit in their body due to a huge loss of blood or fluid during the time of surgery. Also, we are going to see the client can be present with electrolyte imbalance very commonly during this phase of post operation. Acid-base balance also is a very common complication among the patient in post-operative phase. We are going to see the potential problems also related to the urinary system can be present commonly among the patient in the post-operative phase. It includes the retention of the urine or maybe infections in the urinary tract as well as incontinence. So these three are very common symptoms during the time of post-operative phase for a client. The problems related to the gastrointestinal tract, which are very common in post-operative phase, includes the nausea, vomiting, hiccups, and a delayed gastric emptying or altered peristaltic movement. So that is the reason why a client should be assessed continuously for their peristaltic movement, their appetite, for their presence of any episodes of vomiting. Now, basically, this helps a nurse to identify their nutritional need and supplement essential nutritional component in order to manage the client. We are going to see the assessment should be done for the neuropsychological term as well, because the potential problems related to the neuropsychological term are the pain, fever also can be there, which is basically a hyperthermia. Even the client can develop with delirium or post surgical delirium. There can be presence of hypothermia even related to the neuropsychological problem, as well as there can be presence of post-operative cognitive dysfunction. So as we have learned regarding the detail of the potential problems that can be present for the client in a post-operative phase, we have focusedly seen each and every system and the potential problems related to the each system. Now we should discuss regarding the nursing role or the nurse's responsibility to provide the interventions in order to manage those potential problems. So here we are going to discuss regarding the general care or the general interventions which would be often done by the nurse in a post-operative session. So first we are going to see the respiratory interventions which will be often done by the nurses in order to maintain a proper respiration for the client in a post-operative phase. So the first and foremost intervention in or respiratory intervention is positioning of the client. Now it is very important in the post-operative phase. First of all, the positioning should be done to the client depending on the type of surgery that has been performed for the client. Generally, a surgeon would be suggesting or would be telling or introducing a proper position for the client. A nurse is responsible person to provide that particular position in order to manage their respiratory system, or in order to maintain a proper airway, as well as in order to reduce the pain and reduce the chances of hemorrhage. So positioning of the client is the major and most important role of the nurse in a post-operative phase towards the client. The next point is ambulation of the patient. It has to be noted that the ambulation or the early ambulation of the patient helps to manage a proper respiration or a proper respiratory functions. So, with the permission of surgeon and physician, early ambulation should be done for the client to manage the respiratory symptoms. Now, immediate to the post-operative or post-operation, we are sometimes going to see the client will be having decreased oxygen level in their body. Oxygen administration plays here a very important role. So it is a nurse's role to collaborate with a respiratory therapist and to provide adequate oxygen administration via the nasal cannula and via a face mask. Medications also can be used here with a proper prescription by the physician. Medications would be generally provided to manage the incisional pain, which also helps to maintain an adequate respiration for the client. Adequate hydration should be provided to the client by the nurse in order to maintain the proper respiratory function, because you have to remember dehydration can also cause altered respiration level for the client in post-operative phase. Next, we are going to see the common interventions that would be taken care by a nurse during this phase for the cardiac symptoms. So first and foremost important interventions for cardiac system is frequent monitoring of the vital signs and basically the ECG monitoring. So as I said, during the post-operative phase, our client would be having a very high risk for the development of dysarrhythmias. A continuous 12-lead ECG monitoring would be helping the nurse to identify the sign of dysarrhythmia in an early stage. Also, a continuous monitoring of the vital signs would be helping the nurse to identify the functional ability of the client's cardiac system. It is a nurse's role to document the vital signs and the cardiac rhythm and rate, even the blood pressure for a regular interval for the client. Comparison should be done for the pre-operative findings and the post-operative findings in order to find out whether the client is maintaining an adequate health status. So we will be also seeing sometimes the oxygen administration plays here a very important role. If the client is having deprivation of the oxygen supply towards the heart muscle or towards the cardiac system, or the fluid and blood loss should be also minimized here during the time of post-operative surgery, which basically helps proper functioning of the cardiovascular system. Also, we are going to see the client will be managed with analgesics and certain medications in order to manage the pain, in order to increase the functional ability of the cardiovascular system. If the client is present with dysarrhythmias, the adequate management should be done initially to manage the client and to prevent for further complication development. Also, we will be seeing maintaining adequate intake and output helps the nurse to promote the cardiac functional ability for a client in a post-operative phase. Prevention of venous thromboembolism should be ensured in this post-operative phase. Syncope prevention also plays a very important role, as the cerebrovascular perfusion can be altered. So that is the reason why frequent position changing, if it is not contraindicated, should be done for a client in a post-operative phase. Next, we are going to see the common management for the pain. So definitely in a post-surgery, the client will be complaining regarding a very painful scenario. So we should provide first a comfortable position with the prescription of the surgeon and physicians. Also, we should provide them with adequate comfort devices, if needed, air mattress or comfortable mattress. They will be also provided with some calm and quiet environment. If needed, most of the patient will be receiving the analgesics. So it is a nurse's role to provide proper dosage of analgesia to manage the pain in post-operative phase. Patient-controlled analgesia also can be used in post-surgical phase. Basically, it is a new approach, is mainly to maintain a constant and steady level in the blood for the analgesics, which also would be definitely administered immediately. So this route of the patient controlled analgesia basically includes the epidural route, the intravenous route, oral or transdermal route. Now, nurses play a very important role to educate the client regarding the usage of patient controlled analgesia in post-operative phase. Comfort measures should definitely ensured by a nurse towards the client to manage the pain in a post-operative phase. Neurological symptoms are very common, as we have studied here, because the person will be recovering from the anesthesia. So the common interventions, which will be including the maintenance of a normal physiological function for the client in the post-operative phase. Fluid electrolyte balance should be maintained here. The pain management plays a very important role. Most of the time, the patient will be anxious, or very much anxiety will be there for the client in a post-operative phase. So it is a nurse's role to provide psychological supports to the client. Nutritional management also helps to maintain the neurological symptoms. Temperature, or the maintenance of the temperature here, plays a very important role in the post-operative phase. So basically, we will be seeing the nurses would be using the passive warming technique. So the passive warming technique basically involves the usage of warm blankets, socks, and limiting the skin exposure to the environment. That is how the temperature would be maintained for the client who have undergone a surgery. Active measures also would be taken care by the nurses. So basically, they will be providing warming devices, forced air warmer will be provided, radiant heater will be provided to the client in order to manage their body temperature. If the person is having hypothermia, generally the antipyretic drugs can be used by the nurse, or can be administered by the nurse with a prescription. This also would be helping the nurse to identify whether the fever is associated with the sign of infection. That helps to early diagnosis of the presence of infection and a proper management towards it. Maintenance of the hygiene here plays a very important role in the post-operative phase, as the client is going for a surgical technique and incision will be present over the skin. It is a nurse's role to maintain an adequate hygiene here in order to maintain the infection. We are going to see also the interventions will be taken care by the nurse in order to maintain a normal gastrointestinal function for the client in a post-operative phase. Oral fluid should only be given if it is prescribed and if tolerated by the client. So initially we are going to see the patient can be managed with an intravenous fluid infusion. So in case the person is not tolerating with the oral fluid, intravenous fluid infusion also can be done for the client to manage their nutritional level. Generally, the lateral recovery position would be given to the client in order to reduce the aspiration if the client is taking oral feeding. Nasogastric tube also can be used for the client who are not a recipient of IV infusion, even oral intake. Naturally, a nil or oral or NPO state would be ordered if the person is not getting back their peristaltic movement. So it is a nurse's role to assess the problems related to the GI tract or gastrointestinal tract and to intervene in an adequate manner in order to maintain their nutritional status. So remember, once the person is well tolerated and if it is prescribed, then only the oral food or oral liquid would be provided to the client. Otherwise, the person would be provided with IV infusion or maybe parenteral and enteral nutrition. Sometimes we will be using the nasogastric tube feeding in order to maintain the nutritional status of the client. Next, we are going to see the urinary problem related interventions. So basically, most of the client will be on catheter to maintain the urinary output immediately in a post-operative phase. Later, once the client is stable enough, we will be removing the catheter and the urinary output should be measured in this phase in order to understand the proper perfusion or adequate perfusion in the patient body. We'll be also assessing the integumentary system as we have mentioned before. So basically the interventions includes the documentation of the type, color, amount and odor of the drainage from the surgical site. So this is a very important nursing role to notify if there is any abnormal drainage or excessive drainage is present. So that is the reason it is very important to assess the type of drainage at a regular interval. Dressing should be changed if needed at a regular interval or as prescribed by the surgeon or doctor. So also the nurse while changing the dressing should check the surgical site for presence of any inflammation or color changes over the screen. That would basically prescribing or suggesting the nurse to identify the initial presence of infection, which helps the nurse to intervene or which helps the nurse to manage the client at an early stage and prevent the complication related to the infection. So as we have mentioned, the infection control here is very important for the nurse because they will be having a high risk for the contamination. There can be chances of increased contamination. Even the patient who is coming from operation theater will be often present with the surgical incision. So definitely they will be having more chances to develop with infection. So it is a nurse's role to provide adequate hygiene in the surroundings, as well as the client also should be taught regarding maintenance of the hygiene. Now, if the client is not stable enough or they are not having a stable health status, it is a nurse's role to maintain their hygiene in order to make sure or in order to prevent the chances of the development of infection. So I hope we have learned here regarding the each and every potential problem depending on each system of the body, as well as we have read about the probable management or the common interventions which would be done by a nurse to manage the client in post-operative phase. Now it is important to note down the type of discharge or the nurse's role while discharging the client from a post-anesthesia care unit. Generally, once the client is managed immediately in a post-anesthesia care unit soon after the surgery, a nurse would be or a physician would be discharging the client from the post-anesthesia care unit to a general clinical or medical unit. So it is a nurse's role who is present in the post-anesthesia care unit to transfer the client in a general medical unit. They also do communication towards the nurses who are going to take care of the client in the medical unit. So proper communication should be done by the nurses. It is a very important and prominent role while discharging the client from the post-anesthesia care unit into the medical care unit. Monitoring and comparing the vital signs here plays a very important role, even to the clinical unit or medical care unit. So next we are going to see while admitting the client into the clinic or medical unit, the nurse would be doing a in-depth assessment here in order to find out the changes or in order to find out any signs related to the complication that is present in the post-operative client. So once the client is managed here in the medical care unit and adequate recovery has been taken place for the client is self-sufficient to manage and to maintain their health, the discharge can be planned. So basically the discharge will be planned by a surgeon and or physician. A nurse also would be taking part in the discharge planning. So once the discharge plan is done from the medical unit, the nurse have a very vital role in this phase to educate the client related to the lifestyle modification and the behavior after the post-operative care. So as the teaching of the client should be done regarding the lifestyle changes in this phase by the nurses. The nurses would be focusing the client or focusing on the nutritional supplementation and the nutritional intake of the client. So a client would be described or demonstrated or discussed enough with the necessary nutritional habits. They will also be suggested to take a proper amount and adequate intake of the fluid and diet for the client in the post-operative phase. Also, the nurses will be teaching about the adequate rest and sleep as well as the exercise and resting pace. So, generally, for a post operative client, nurses will be deciding about their rest and exercise pace. So also we will be seeing the client will be educated regarding their sleeping pattern. Also lifestyle modification should be done about their daily habits. So this is a nurse's role to educate the client. If the client is having habit of smoking or alcohol consumption, they should order the client to reduce the alcohol consumption and the smoking. Also, the nurses will be educating the client here regarding the maintenance of hygiene. As the client is having a surgical incision, it is very important to maintain the hygiene in this phase, and nurses would be basically describing and demonstrating the hygienic practice that has to be maintained by the client in this phase. Also, the dressing change and providing the dressing or doing the dressing also would be demonstrated by the nurse towards the patient or to their caregiver. Adherence to the medication or the importance of the adherence to the medication should be described and discussed with the client. Also, the rationale behind the continuous medical treatment should be described to the client after the surgery or in a post operative phase while discharging the client from the medical unit. The nurse also should teach the client regarding the availability of emergency care. So it is a nurse's role to educate the client regarding to identification of any early sign and symptoms that is indicator of the presence of any complication. And also they would be described or they would be discussed regarding the emergency care that is available to seek for emergency medical help. Also, the nurses would be teaching the client regarding the essentiality to follow up, and they will be educating the client regarding the importance of follow up. So I hope till here you have completely understood the concept of post-operative care. So in this sessions, we have learned regarding pre-operative, intraoperative and post-operative care. It is very important part of nursing because we, the nurses, will be taking care of the patient while the patient is going for the surgery. Here in this phase also it is included that the psychological support or the proper counseling and anxiety management plays a very important role to early recovery or to promote the health of the client. So I hope you are completely aware now regarding the peri-operative nursing care. Thank you so much for attending the session. We'll meet you guys in the next session.